Before providing an enteral feeding, check the patient's baseline weight. Review his lab results, such as blood glucose and electrolyte values, and check the details of the healthcare provider's orders. Perform hand hygiene, ensure privacy, and introduce yourself to the patient. Then identify him using 2 identifiers.
Can you tell me your full name and date of birth?
Tom Sheldon, 11/16/60.
Okay, great.
Ask the patient if he has any food allergies. Explain that he'll be receiving tube feedings and discuss the physical assessment procedure. Apply clean gloves and auscultate for bowel sounds and assess his abdomen. Make sure the patient is in the high Fowler's position or elevate the head of the bed to at least 30, but preferably 45 degrees. If he must remain supine, place him in the reverse Trendelenburg position. Obtain and verify the patient's formula. Check its expiration date and note the condition of the container. Make sure the formula has reached room temperature. Use aseptic technique as you prepare the formula for administration and manipulate the feeding system components. Shake the container thoroughly and clean the top of the can with an alcohol swab before you open it. If you're using an open system, pour the formula from the can into the administration bag.
Make sure this lid's on.
Hang the bag and prime the tubing. If you're using a closed system, again check its expiration date and note the condition of the container. Make sure the formula has reached room temperature and shake the container thoroughly. Then connect the administration tubing to the container. Verify correct tube placement. Refer to the video skill Managing a Nasogastric Tube. Check the gastric residual volume, or GVR, before each intermittent feeding, or every 4 to 6 hours if the patient receives continuous feedings. To do so, draw 10 to 30 milliliters of air into a syringe. Connect the syringe to the end of the feeding tube and inject the air into the tube. Then pull back evenly to aspirate the gastric contents. Next, flush the tubing with 30 milliliters of water. Before you attach the administration set to the feeding tube, trace the tube to its point of origin and label the administration set Tube Feeding Only. Label the bag with the type, strength, and amount of the tube feeding, and the date, time, and your initials. Change the bag every 24 hours. To administer feeding, pinch the proximal end of the feeding tube, remove the cap, and attach the tubing. Set the infusion rate by attaching the tubing to the feeding pump or by adjusting the roller clamp. Allow the bag to empty over a period of 30 to 45 minutes. Gradually advance the rate of tube feedings as ordered. Cap or clamp the end of the feeding tube used for intermittent feeding when not in use. Flush the tubing before and after each intermittent feeding. Remember to flush the tube every 4 hours during a continuous feeding or according to your agency's policy. The head of the bed should remain raised until at least 1 hour after the infusion is complete. Rinse the bag and tubing with warm water whenever a feeding is interrupted. Use a new administration set every 24 hours. Perform hand hygiene and document patient care.